The oncology pharmacy is just a specific specialty pharmacy for patients who are diagnosed with some type of cancer, either a hematologic type of cancer or a solid tumor. And so we take care of those patients, their needs, work with the physicians to ensure that we are taking care of them appropriately. So what I do is I review all the patients that are scheduled to receive infusions in our new infusion suite. Very excited about that. And I will do a clinical review of those patients to make sure that, the treatment that the physician is prescribing has gone through all of the dose checks as far as like renal function, liver function, anything else pertinent to that specific drug. Do specific drug ordering for those patients, any other type of clinical review that might be needed.
So I am the only technician here for right now, and I make all the compounded medications for the chemo patients and the off-service patients. Most patients will come in every day and they'll get labs done before they go talk to the provider, and then they'll come over to infusion where they'll get the height and weight, and based on their lab results and their height and weight, they'll then, Lydia more specifically, she'll calculate the doses for every patient based on their weight fluctuation and their baseline for their weight and height, and how their labs are looking, if anything's changed from the last time that they came in to get treated, or if it is their baseline, then how we can adjust the dose based on what we were expecting versus how things really are. We have very, very high dollar medications. All the chemotherapy that we have is extremely expensive, and we can't really afford to waste any of it.
Every drug is very unique and specialized, and so we take a lot of care to make sure we have all the details down and get those to our patients for our nurses to infuse.
Cancer specifically hits very close to home for me, with people in my family, people in my fiance's family, and it's just, I'm very, very passionate because I want to help these patients.
We're seeing somewhere between 15 to 20 patients a day right now. We're also starting to take on non-oncology patients who need specialty treatments as well. And so we're seeing our volumes increase even further from that. We're continuing to grow, so very excited for the future.